Have the numbers changed? I think that's a good place to start. Have you seen more as over the past like 5 years, as it becomes more, I mean, relatively socially more acceptable, or have the numbers always been the way that they are? And there's just been a lot of like people don't know about this issue, and maybe you could talk more about that.
Yeah, absolutely. So, if you don't mind, I'll offer a little language suggestion for you too. We don't use gender reassignment to talk about the hormone care that we provide at our facilities. And there is some stigma within the trans community about using the term gender reassignment. So, what we talk about is gender affirming care. So, I just
Oh,
wanted to
okay.
share that with you.
Yeah, I don't know.
Um,
So
yeah,
learning a lot. I'm
exactly.
learning a lot today. So
Yeah, exactly. And I think, you know, my biggest suggestion to folks who are maybe, talking about trans care for the first time or talking about trans folks is first of all to recognize like we're all going to make mistakes. I am a cisgendered person. I am not a trans person and I make mistakes all the time. And so I think being open to just being like, whoops, I made a mistake. Thank you for that suggestion. I'll make that change and then just kind of move on too. So I have also learned a lot in the past 5 to 6 years. And what I would say too about trans and non-binary care is as it is becoming more acceptable to talk about, the language evolves and it's a moving target. So maybe the language we talk about today in a year or two will not still be the language that's used. I find it's a rapidly moving space. So I would say these folks have always been there, always. They just have not been able to access safe care before. So there are some really impressive statistics around trans folks, trans and non-binary folks, not just reporting like poor care in medicine, but reporting actual like harmful or traumatic care. I have a handful of trans folks in my social circle, and I can't tell you the number of just horrific stories I've heard about the type of care that they receive when they go to places like a hospital. So for instance, I have a friend who's a trans woman, um, and I'm sorry. Well, I'll tell a different story. I'll tell a different story because this is
okay.
it's a better synopsis. So I have a friend who is a trans man. So, you
So
know,
before we move on, can you describe that? Because someone may not know.
yeah, absolutely. Absolutely. So trans refers to somebody who, whose gender identity, who they are on the inside and who they identify as is a different gender than basically the parts that they were born with. So we sometimes use the term assigned female at birth or assigned male at birth, and that's kind of your sex assigned at birth or the designation that you were given. And so trans folks identify as not that. And so maybe in their case, their external genitalia does not match their internal concept of their own gender.
And so when you
Um,
say trans man, it's you can
Somebody
describe.
who is assigned female at birth,
Okay,
but then identifies as a man.
gotcha.
So maybe their external parts might look female to us, but their gender identity is male.
Okay,
And then on the flip side, if you're a trans woman, you're assigned a male sex at birth and may have what we would say are male parts, but your gender identity is female.
gotcha. So you
And
have your
then,
friend who's a trans man.
yeah, and then a term that you may hear thrown around is gender dysphoria. And that means basically like the ickiness and malaise and terribleness that people feel when they have to exist in a body that does not feel like the right gender, right? So if
Mm,
you were assigned male at birth, you have male parts, but your identity is female, gender dysphoria is that horribleness, ickiness that you feel having to exist in a body that does not feel like the right gender to you or
okay.
is not the right gender. Not that it feels like the wrong gender, it is not the right gender for you. So I have a friend who is a trans man and has been on hormones for many years. So honestly, if he walked into this room right now, you'd say, "Oh, he's a dude," right? And so he had an issue with recurrent UTIs or urinary tract infections, and so went to the emergency department and said, "I think I have a UTI. I get them all the time." And the doctor just repeatedly kept saying, oh, this is so weird. We don't, because UTIs are much more common in people with female parts. And that's because the female urethra is much smaller than the male urethra. So it's easier for bacteria to climb up and cause an infection. It's a shorter climb, so it's easier to happen. And so the doctor came in and said, oh, this is so rare. We don't see recurrent UTIs in men. And, this is so weird. Brought residents, brought medical students into the room. And the whole time my friend is trying to go, you know what, you're mistaken. Like I'm a trans man. I have female parts. So this isn't so weird, right? Like I have,
Yeah.
you know, tried to interrupt, tried to tell. This doctor came back with residents, with medical students, and basically said, we'd like to do an exam now, and like exposed my friend's genitalia and was like, whoa, what's this? I mean, how
Jesus.
awful, right? Exactly. How awful. So let me tell you, that friend will not go to emergency departments anymore. Like
Yeah.
they were exposed in front of a crowd and made to feel incredibly embarrassed. And this is something that they experienced dysphoria around at baseline. So to sort of have this pointed out, to have this horrible experience, it's bad, right? Like that makes those folks not want to come back to care, right? So I've heard this type of story many, many times from trans men. So a lot of trans men end up being like, I know I have a UTI, but I do not want to go get stigmatized care. So I'm going to just try to like deal with it. I'm going to drink a lot of water. I'm going to drink cranberry juice. And then maybe end up with a worse infection, like a kidney infection. And that's the exact pattern that I see for a lot of trans or gender diverse folks, is that because of the stigma and harm that they've experienced in traditional medical settings, they're just not going to go anymore. They're just going to avoid the care at baseline. And I think that's really problematic because we know outcomes are worse when people don't get basic preventive care, which kind of comes back to, ways to take happy, healthy care of yourself, whether it's your sex life or just, taking good care of your body. Cancer screenings are, the percentage of trans folks who get their routine cancer screenings, whether it's cervical cancer or colorectal cancer screenings, are much, much, much lower because they just don't want to come into these spaces at baseline because maybe they got, exposed in a very embarrassing way at their last appointment. Another common story that I hear from trans folks is, people coming out into the waiting room and using their dead name. So their name that they were assigned previously, but that they don't use anymore.
Mm.
So, getting outed with their dead name. That's another common story that I hear of, just ways that they don't feel comfortable in these spaces. And the issue is often the name that they use is not in accordance with the name on their insurance card. And it's amazing how in medicine, we're not very flexible about those types of things. And so, people will always defer to the name on your insurance card, even if that's not maybe the name that you use in day-to-day life. So I wanted to take a moment too to talk about one other term I've been using, which is non-binary. So, we think often of gender as being on a spectrum of male or female. And when we talk about, trans men, those are people who are maybe assigned female sex parts at birth, but identify as male. That's still on that very like dyad spectrum of male and female. Whether you're a trans man or a trans woman, you're still on that very dyad spectrum. And non-binary refers to folks who identify somewhere in between or fluidly. There are also people who identify as gender fluid, meaning maybe their gender identity is not the same from day to day, or maybe they just land somewhere on that spectrum that's not fully male or fully female, but somewhere in between. So I have quite a few patients for whom we do low dose hormone therapy. So they're not trying to get to all the way on the other end of that extreme, but they're trying to end up somewhere kind of in the middle.